Okay, hello everybody. My name is Tian. I will be sharing highlights from my MPH practicum at the BC Ministry of Health and my Culminating report, which examined youth social media harms in BC through a commercial determinant of health lens. I'll focus on why this issue matters, what the evidence shows in BC, and what it means for public health practice. So before I begin, I'd like to do a line acknowledgement of that we are residing in the territories of the Songhees, the Esquimalt, and Wasanac nations. And then I'd like to begin that my practicum took place at the BC Ministry of Health and is within the Population and Public Health Division. Branch. I supported the Provincial Safer Screen Use Initiative, an emerging and politically sensitive area at the intersection of youth mental health, digital environments, and public concern. My role within the ministry focused heavily on translating complex and often uncertain evidence into policy-relevant products that could be disseminated across the province. Over the practicum, I developed several core knowledge products, including a provincial surveillance needs assessment slide deck, presented to the entire branch a project initiation document to guide development to safer screen use guidelines that we're creating, briefing materials, and governance documents such as a terms of reference to support cross-sector advisory processes. A key part of my placement was working in intersectorial spaces, engaging with partners across health, education, and other ministries, and applying a commercial determinants of health lens to help shift discussions away from individual behavior and towards structural drivers of harm. This placement gave me direct experience in how evidence, feasibility, equity, and politics intersect in real-world public health decision-making. Building on that overview, my responsibilities span assessment and analysis, communication, and policy planning. And this includes synthesizing academic and grade literature, interpreting BC surveillance data, and translation of findings into materials appropriate for senior decision makers. I also supported project management and coordination for intersectional engagement, including early planning for a best brains exchange. So to ground this work, it's important to understand the context. National and provincial data shows a marked deterioration in youth mental health over the past decades. Multiple Canadian surveys show a substantial increase in mental health and distress among adolescents. Just want to show an example here, but the course is 10 minutes, I couldn't fit everything in. So as an example, the Canadian National Survey, which we see trends that use 12 to 17 years of age who considers their own mental health as very poor have doubled between 2019 to 2023. And in Ontario, through the Drug Use and Health Longitudinal Survey, we can also see a substantial increase to adolescents with moderate to serious psychological distress. Provincial data also reflects a similar pattern. The BC Adolescent Health Survey shows a steady decline in the proportion of youth reporting good or excellent mental health, which dropped from over 80% about a decade ago to approximately 60% in 2023. The data on the right also shows that female and non-binary youth are more severely impacted by mental health related harms, especially in percentages of reported self-harm and suicide ideations. And these trends underscore that this generation is experiencing heightened mental health challenges during a period of rapid technological change and reinforces the need for clear evidence-informed public health guidance that reflects the realities of young people's digital environments. So additional provincial data shows increasing health harm related hospitalizations and poor well-being indicators over time. So this data is from inpatient injury hospitalization data, or IDOT. And we can see that as screen use has increased, some concerning trends in youth mental health across Canada, and BC have also emerged, such as increased hospitalization rates due to self-harm in youth and adolescents. We also found that multiple surveillance sources demonstrate declining rates of positive mental health and well-being. along with higher rates of anxiety, depression, loneliness, and self-harm. These shifts coincide with major changes in the digital environment through near universal smartphone access, the rise of social media, and the increased screen use during the pandemic. While no single factor explains these trends, they coincide with rapid changes in youth screen use, particularly social media and smartphone engagement, highlighting why this issue has become a priority for public health action. One of the clearest findings from both the literature and BC surveillance is that harms are not primarily driven by total screen time. Instead, nighttime use, sleep displacement, and problematic or compulsive patterns of use show much stronger associations with mental health outcomes. This finding challenges time-based guidance, and it underscores the need for a more nuanced, context-specific public health approach. So my Culminating paper applies a commercial determinants of health framework to social media, which reflects the broader work that I did with the ministry, which is on screen use. From this perspective, youth harms are not accidental. We found that platforms are designed to maximize engagement through persuasive features like infinite scroll, autoplay, and algorithmic amplification. During my practicum, this framing became especially salient when we found major corporate initiatives, such as the Rogers Initiative in January, frame screen harm as an individual behavior problem, and it highlights how commercial actors can shape both the problem and the narrative of solutions. BC data also shows that harms are unevenly distributed. Girls and gender diverse youth experiencing food insecurity, and those with adverse childhood experience are also reporting higher rates of problematic and nighttime use, as well as poor mental health outcomes. And it shows that social media doesn't just create inequality, but it also amplifies existing disadvantage, making equity-oriented public health responses essential. I also applied an intersectional lens to my work, and was essential to understanding youth screen-related harms in BC. Provincial surveillance data and youth engagement findings show that harms are not experienced uniformly, but are shaped by the intersection of gender, socioeconomic status, and lived experience. Girls and gender diverse youth report higher exposure to experience-focused content, cyberbullying, and mental distress. And while youth experiencing food insecurity or adverse childhood experience are more likely to report problematic and nighttime use, these intersecting vulnerabilities also mean digital environments can amplify existing inequities rather than impacting all youth equally. From a public health perspective, this reinforces that one-size-fits-all guidance is insufficient, and that equity-oriented upstream approaches are needed to avoid widening disparities. For public health practice, these findings suggest that behavior-only or time-based approaches are insufficient, and instead, effective responses require upstream action, such as addressing platform design, improving governance, and strengthening surveillance to capture high-risk patterns of use. This mirrors how public health has approached other commercial exposures, such as tobacco or alcohol. So this practicum strengthens several core public health competencies. For example, develop assessment and analysis skills by synthesizing academic literature, provincial surveillance data, and youth engagement findings to inform decision-making in an area with limited causal certainty. I also strengthened the policy and program planning competencies by contributing to foundational planning tools, such as using a project initiation document, Gantt charts, tours, as well as other governance documents that supported my next phase of guideline development. I also advanced communication and advocacy skills by translating complex evidence into senior decision makers and applying a commercial determinants of health lens to screen use harms as a structural public health issue rather than an individual behavior problem. One of the key insights I gained from my practicum and from my MPH is that evidence alone rarely drives policy change, particularly in emerging and contested spaces such as youth screen use. And although there is a growing body of evidence linking social media to mental health harms, translating that evidence into action depends heavily on how it is framed, whether it aligns with institutional priorities and whether it is considered a feasible within political and operational constraints. So applying a commercial determinants of health lens fundamentally shifted how I understand digital harms, highlighting that many of the risks youth experience are structurally produced rather through an engagement-driven platform design rather than individual behavior. And at the same time, BC data clearly shows that these harms are not evenly distributed, with greater impacts among girls, gender diverse youth, and youth facing socioeconomic adversity, reinforces that equity must be central to any effective public health response. Finally, working within government reinforced me that public health practice is inherently political, requiring navigation of uncertainty, power, and competing interests while continuing to center prevention and population health. Finally, I'd like to acknowledge the support of my MPH peers and professors, my academic supervisor, Dr. Jeff Masuda at UVic, and also my practicum supervisors at the BC Ministry of Health, Daniel Naiman and Laura Metcalf. And I'm also very grateful for all of the continued mentorship and support from my colleagues at UBC Dentistry, which is my alma mater for my undergrad, as well as my wonderful teams at Small City Square Dental, as well as Sculpture Tower Dental Groups throughout my MPH journey. Finally, I'd like to thank my wife for all of her continuing support and for being here. Thank you.